Hello everyone.
Welcome to Project LAS.
I'm Clover.
I'm Lily.
I'm Jazz.
And I'm ASHA.
We are a group of IB and BTech students here to help you guys through life at KG5 with this little video series. We help summarize lessons of PSHE with the expert advice of those who have already been through NYP and GCSEs.
And today, we'll be focusing more on the student themselves rather than what they do. That's right, it's mental health.
You may have heard some of this information over and over, but it's important to take it into account. After all, you can do your work if you yourself can't work.
Let's start with anxiety. Anxiety can come in many different forms, like worry and stress.
Worry is when your mind is stuck in a negative mindset and regularly assumes the worst case scenario. This only affects your mind, your thoughts, and can influence what decisions you make.
However, worry itself doesn't include the physical manifestations of anxiety, called stress. Stress is what your body goes through when, stressed.
This can be useful in fight or flight situations with the adrenaline rush and all, or times where you need to get stuff done quickly.
Anxiety is a mixture of both, the mental and the physical. It's usually triggered by something like an incredibly stressful event. There's rarely an actual physical threat, but that doesn't mean it's not valid to feel anxious sometimes.
It's completely normal to feel anxious at some point in your life, especially during exams. Everyone's gotta experience it at some point.
However, we do need to clarify that regular anxiety is different from an anxiety disorder. There are many different types of anxiety disorders out there. However, we'll just talk about the three most common ones. These disorders can cause someone to avoid certain situations so they don't risk making their anxiety worse.
First, let's touch on phobias. Phobias are defined as an uncontrollable, irrational fear of a certain thing. These have the potential to cause frequent anxiety and, in extreme cases, panic attacks when faced with the object or scenario.
There's two main types of phobias, specific phobias and complex phobias. Specific phobias are more common as they focus on one type of trigger, like spiders or blood. These develop during childhood or adolescence and don't usually affect a person's daily life.
Unless you have a fear of heights and live on the 30th floor, which kinda sucks.
Wait, wouldn't living higher up prevent you from developing a fear of heights?
I mean, not necessarily. There's genetic factors that can apply to specific phobias, and certain complex situations that can lead to the development of one.
Speaking of complex, let's talk about complex phobias. These are the opposite of specific ones. They affect your daily life, can have multiple factors to them, and usually develop in adulthood or later.
An example of a complex phobia would be agoraphobia, which is the fear of getting into a situation where you can't get out in case you fall into a panic attack.
However, this is different from a social anxiety disorder, which is a disorder where you feel anxious while interacting with others. This is usually born out of the fear of being judged, causing struggle with meeting new people and even avoiding social outings altogether.
This may result in any of the aforementioned symptoms when in a social situation, even something as simple as lunch with friends.
Another disorder that can cause panic attacks is, a panic disorder. This disorder has an increased chance of causing panic attacks in the person who has it.
Wait, who's panic and why are they attacking all these people?
A panic attack refers to intense waves of fear that don't usually have a clear cause to them. It can be triggered by any number of things, like phobias or anxiety disorders.
The first thing you should do when you or someone else is having a panic attack is to calm down. There is a lot of ways to do this, like the 5, 4, 3, 2, 1 method, where you list out things you can see or feel to ground yourself.
Another method that can be used here is the 4-7-8 method. It's a breathing tactic where you breathe in for 4 seconds, hold it in for 7, and breathe out for 8. This helps control your breathing and relaxes your mind, preventing the attack from getting worse.
You can also use box breathing instead, where you breathe in for 4 seconds, hold for 4, and out for 4 as well. This one's more suited for times where you struggle to hold your breath for long.
Of course, maybe all you need is a good distraction. You can count to 100 in your head, or recite the alphabet backwards, whatever works.
If you find yourself a bit too preoccupied to think or say anything, get a friend to chat with you for a little bit, or just be there with you.
If you end up being the friend, just make sure you get permission before talking to them.
You can also guide them through the above grounding methods with prompt questions such as, "What can you see?" or demonstrating slow breathing to the person in the panic attack.
Now, let's move on to another common mental health issue, depression. This disorder is seen when someone feels hopeless and numb to their surroundings, and periods of sadness called depressive episodes.
Depressive episodes can affect many aspects of a person's lifestyle, whether that be academically or socially.
Here are some symptoms of depression and depressive episodes, including losing enjoyment in your hobbies or extracurricular activities.
These type of episodes will usually last all day for at least 2 weeks, according to the WHO.
The who?
Exactly. However, there are different types of depressive disorders, such as a recurrent depressive disorder, when someone has a history of having at least 2 depressive episodes in their life.
There's also bipolar disorder, which involves both depressive and manic episodes, or extreme lows and extreme highs. These can cause large shifts in your mood depending on the episode.
For depression, there's a lot more professional ways for treating it outside of school. While the counseling services here are great, they can't provide a real diagnosis for you.
If you suspect yourself of depression or anxiety, talk to a psychologist. They can lead you through the types of therapy to help, such as cognitive behavioral therapy, interpersonal psychotherapy, or whatever works for you.
If you want to try a less personal approach, you can talk to a doctor and see if they'll prescribe you antidepressants like SSRIs to help with your depression.
Take that, depression!
It's important to remember that your mental health is all about you. So you gotta ask for help first, and speak up if you don't think something's working for you. There's no shame in seeking assistance.
However, if you don't have access to professional treatment or think it's unneeded for now, here are some ways to help outside of any medical scenarios.
Keeping yourself out of isolation is important. Even if you're an introvert, social interaction is crucial for your brain. Sometimes all you need is to spend some time with a friend.
Exercise and routine are also important no matter who you are. It helps to keep a constant thing between each day, which makes everything a little less chaotic and easier to handle.
Of course, the school, counseling services, and the We Talk Hub are always there for you if you need it, whether for support in a panic attack or just help with any disorders in general. The school keeps everything confidential unless you're hurting others or yourself, so you can rest easy.
You can also ask for support from your teachers, like clarification on a concept or checking over a past paper you did. They aren't going to think you're dumb for asking for help. After all, it's their job to help you pass.
The school is here to help you and see you succeed, so don't prolong asking for help if you suspect you need some or if you would like some support.
And if your mocks are coming up soon, there's not much need to worry about them.
I mean, they're mock exams for a reason. It's just practicing being in an exam hall and doing full papers in a timed condition.
Overall, mental health is a complex subject, so try not to assume anything about yourself or others, no matter how tempting it is to do so.
Take care of yourselves, and
Thanks for watching!